Before you are going to change the resident diapers, you are supposed to check all the equipments ready, like your diaper trolley. For example, like the plastic bag must be totally new one because you're going to change a lot of residents out there. And then your things like the wet wipes, the barrier cream, the disposable gloves, and for some resident the powder, and then the urine eliminator for removing the odor, and then the hand rub for medical hand hygiene, and then in some cases the air fresheners. So some resident may need like the Euro sheet to place underneath. So you check all the equipments are ready before you enter into the resident room. So once you enter to the resident room, you make sure the resident have full privacy, and if the windows are open, make sure you close the windows, and if the curtains, you make sure you draw the curtains for full privacy. And then you make sure you do medical hand hygiene 7 steps. Palm to palm. You are supposed to do hand hygiene at least 20 seconds. And it is always a good idea if you can explain to the resident what you're going to do if he or she is communicable, to stop being frightened or scared for the procedure what you are going to do. So if they are being frightened or scared, they will not cooperate with you. So I explain the procedure to the resident what you are going to do. Now we are going to check the diaper. So you check first if the diaper has been soaked with urine or even feces. Then you are supposed to check the color, the smell of the urine, the amount, and also the feces, what type of the motion he has, like loose motion or semi-fluid or watery diarrhea. Everything you need to check and make a record. And then you also supposed to check the skin area around the genital, whether it has the skin tear, excoriation, or any skin breakdowns. You need to check, and then you need to make a documentation. Before we change to a new diaper to the resident, we are going to clean the genital area and perineal area first. At the same time, you check for the skin condition and if there's any back sores or pressure sores. So we are clean the genital area thoroughly and make it dry. Do remember, you should leave the genital area always dry. Otherwise, the skin may break down and then later they may get infection from being exposed to the urine or the feces. And then you turn the resident to the other side. And then you check for the skin area of the back also, because the diaper areas may sometimes causes the skin to the rashes, which they might feel very itchy, and then they scratch, and then it may cause infection. And then because it is the pressure point here, in some immobilized patients, they may get pressure sore or back sore there. So you also check for the sores once you are changing the diaper also. And then after checking, we are going to clean the perineal area also. You clean from inside out and do not rub it or repeat, and it may cause the cross infection also. And then you straight away throw to the dustbin. Now we are going to change the new diaper. So if there's any soil lining, you can use the new plastic bag to collect all the soil lining, and even all the waste you want to throw, you can make a dedicated plastic bag to throw away. And then you may use the barrier cream to protect the resident skin from being infected. And in some cases, some of the resident may need powder to create a barrier between also. So we apply the barrier cream directly, and then we change by simply rolling to one side, and then we take the new diapers, put in here nicely one side, and then you turn the resident to this side. You pull out the old diaper, and then you can put into the plastic bag. And then before you wrap it up, make sure the genital and perineal area is thoroughly dry. And then you put nicely. You may readjust or reposition the diaper also by checking with the resident if he is comfortable with the position. And then you simply stick it to the diaper. So after all this procedure, you can check with the patient if he is comfortable with the position of the diaper, and then you may readjust the height of the bag to the comfortable level. Since we are supposed to adjust the height of the bag to our walk-in comfortable height, then you readjust the bed also, and then you are supposed to readjust the position of the patient. So for conclusion, in changing the resident diapers, you do always remember to wear the gloves, and then remove and change gloves in between each resident, and do always remember to do medical hand hygiene in between each resident also. And then you adjust the height of the bed and put down the backside raise, and then after all the procedures, do remember to put back the backside raise also, and then readjust the back to the lowest level for the comfortable of the resident also. And then after the changing procedure, after you have finished all, and then you reposition the patient position also, because some patient may need 2 hourly turn in the position, and then you do it accordingly, and then you reposition the patient to their comfortable position.